Good afternoon and welcome. I'm Angela Smith, the administrator for the Florida Department of Health here in Lee County. With me today is Dan Craig with Tidal Basin, as well as Lee County Commissioners Kevin Ruane and Brian Hammond. As you know, the reservation system for the available doses this week launched at noon today. We anticipated the demand would exceed the supply, and it did. Lee County has a sizable 65 and older population. We know many callers experienced frustration, and many did not secure appointments. We are rolling out this reservation system so that the safety and welfare of our seniors is front of mind. Those who received reservations today will be vaccinated this week. No one will have to wait in long lines. You only need to come 45 minutes before your appointment. We're in the process of scheduling the 5,000 doses that are available for this week. If you are currently on the phone, please do not hang up. As callers currently in the queue are being processed, and we're moving through them as quickly as possible. Also, please do not call alternate phone numbers. This will not expedite your scheduling. Once on the line with the agent, average scheduling time is less than 5 minutes. More vaccine will be coming from the state to Lee County, and plans for the next rounds of vaccinations will be announced soon. Please check the website www.leegov.com/vaccine. And with that, I'll turn it over to introduce our vendor, Tidal Basin, to discuss the rollout reservation that occurred at noon today.
Good afternoon. My name is Daniel Craig. I am the CEO of Tidal Basin Government Consulting. We are headquartered out of Utica, New York. Today's plan when we rolled out the reservation system at 5 o'clock was to schedule 5,000 vaccinations for this week. We took overwhelming amount of calls, and as soon as we had enough to schedule for this week, the call system went to a busy signal and went to a deferment to tell you that all scheduled appointments are being booked. And what that means is everybody that was in the queue that got in for those 5,000 calls were put into a queue, so that we have more than 100 operators scheduling their reservations throughout the day. That will take most of today to schedule everybody for their appointment. Appointments are taking more or less 5 minutes. There's a series of qualification questions, and there are a series of timeframes that we're looking at to schedule them over the next 3 days. So our plan is to have everybody scheduled. Right now, the call center will be up till 8 p.m. this evening. Those that are in the queue either will sit on holds, or they can go through the reservation system and ask to be called back. If you've been on hold before, you put in your cell phone number and make the request to call back to that number. One thing we do want to stress: do not hang up unless you put in that phone number, and answer the phone if you receive a call. If you do not answer the phone call when you receive it, you will be dropped from the queuing system and dropped out of the system for that 5,000 shot expectation. I do want to say I thank Lee County for everything they've done and prepared us. We knew we were going to get an overwhelming amount of calls. We did receive those, and those I feel bad for that were not able to get in and got a busy signal, simply because we had already filled the queuing system probably before they got in, within the first 3 minutes of us going live. Thank you.
Hi, good afternoon, everyone. I'm Brian Hammond. I'm a Lee County Commissioner. I just wanted to say to the folks who are watching this at home, obviously, this is a situation that many people who did not get through to get their vaccines today were disappointed, and they were upset. And you could understand, just based on the emails that we're receiving in our office right now, the desperation that people have. They want this vaccine. So let me talk to you in just reality. This is it, not polished, not spin. We had 5,000 appointments. We have more than 200,000 people who wanted those appointments. The math just doesn't work. Okay, you can't fit 200,000 people into 5,000 slots. And that's what happened today. Here is the good news. More vaccine doses will be coming to Lee County. The federal government, the state government, and the people who make the vaccines are working around the clock to get vaccines to Lee County and into your arm so that you'll be protected. And we will do everything we can as the county to support that effort to get those shots in your arms. So as we get more vaccines and as we get more appointments, we're going to use a reservation system because we heard you loud and clear that you want a reservation system. We're going to use a reservation system, and several thousand may open up again in another couple days, and you'll have a chance to call in for that several thousand. But again, we will have more people trying to get those appointments than we will actually have appointments available. This is the process we should expect to happen. I'd actually like to ask Daryl Adams at NBC2, at ABC7, Tom Dorr at Wink News, and Sarah Zach at Fox 4 to help us out with this. The public needs to understand what is going on here. And to the media, it's on you to explain it to them in a way that they get it. The criticism that we've received over the last several days has been very understandable, but we need you to help also explain it to the viewers in a way that they get it. We're trying to take 200,000 people and we only have 5,000 shots. It's just not going to work out. And to make them expect that they're going to get their shot any faster than that is just, well, it's media malpractice. So please help us, be a partner. Help us explain to people in an orderly way what's happening. Thank you very much.
And with that, we'll take a few questions. The question was, when can we expect more vaccine and more vaccine doses and appointments? So we're currently scheduled to receive additional vaccines this week. As soon as that occurs, we will open additional appointment slots. The last thing we want to do is have a big list of people and not have the vaccines to go with that. That sets unrealistic expectations for the public. Yes, sir. Okay, I'm going to defer to Dan on that.
I believe your question, make sure I have it right. If you receive a call back from one of our operators, does that guarantee your reservation? For the callback, our operator calls you back on the wait line. Does that guarantee you a spot? As long as you are one of the first 5,000. We have a few additional spots because there will be people who fall off. So we want to make sure, we'll have enough people. Some people may not get an appointment this time around. That will be getting a call back, but those would be the end of the line. I've heard none of those reports. Every time we've called the number, it's gone directly to the call center. So I don't know any of that information.
How many people are at the call center currently?
We have over 100 agents taking calls right now.
So some people, you mentioned that some people individually might have called after all those offers came out, but a lot of people I've talked to, they said they called right at noon and at the 12:02, 12:01, as soon as it opened, it was already getting busy.
We already had people in the queue at that point. We don't know. We're waiting for the analytics exactly how many people called at what time and how many were deferred. As soon as we have those numbers, we'll let you know. But we do think it's in excess of, if not tens of thousands, if not hundreds of thousands.
And kind of following on this question, do some people that had known carriers or unique or types of more luck than others?
Nope. It's all about getting into the system, the 1833 number it's in.
Did you have any additional questions?
Yes. For people are able to get through and get their vaccinations this week, or maybe have already got their vaccinations this week, do they need to use this system to get their second dose?
So the federal government is holding back second doses. So that's a separate inventory from the current inventory that we're dealing with administering the first doses. And we're working out the logistics to determine the very best way to do that expeditiously and not mix first and second dose individuals together. Sure.
Yes, sir, Zach.
Yeah, the governor asked today, if you're looking at state-run sites,
You know, that's a great question. Let me ask Angela. We haven't received any information. The question was about converting the CenturyLink testing site into a vaccination site. We just don't have those details yet. We saw that announcement as well as you did. And Angela, I don't know if you have anything to add to that.
At this time, we have not received any information that CenturyLink would be converted for those purposes, for the purpose of vaccination. Outside of Lee County, no, I don't have that information. Okay. Anything else? Go ahead.
What about the people who got vaccinated on the walk-in? Are they still?
Oh, absolutely. Yes.